The intricate connection between the mind and body is central to understanding psychosomatic relationships and disorders, highlighting how psychological factors can significantly influence physical health. In psychosomatic disorders, emotional or mental stressors manifest as physical symptoms, often without a clear organic cause. Common psychosomatic symptoms include headaches, gastrointestinal issues, fatigue, and chronic pain, frequently linked to stress, anxiety, depression, or unresolved trauma. The interplay between psychological states and bodily responses is complex and bidirectional. Understanding psychosomatic relationships is crucial for holistic healthcare. This perspective not only improves diagnosis and treatment outcomes but also promotes empathy and patient-centered care in medical practice.
Hey everyone, and welcome back to the channel. Today, we're diving deep into the fascinating world of psychosomatic relationships. It's all about how what's going on up here, in your mind, can directly impact what's happening down here, in your body. Think about it. Ever felt butterflies before a big presentation, or a tension headache after a stressful day? That's the mind-body connection at work. Today, we'll explore how our mind and body interact, sometimes in ways that can lead to various psychosomatic disorders. We'll look at the science behind this, the common conditions that can arise, and most importantly, how we can manage them effectively. So, grab a drink, get comfortable, and let's unlock the secrets of the mind-body connection together. So, let's start with the basics. What do we actually mean when we talk about a psychosomatic relationship? Psyche refers to the mind, our thoughts, emotions, beliefs, and psychological processes. Soma refers to the body, our physical being, our organs, tissues, and physiological functions. Therefore, a psychosomatic relationship is fundamentally about the intricate, bidirectional communication and influence between our mental state and our physical health. It's not a one-way street. Your mind affects your body, and your body, in turn, can affect your mind. This isn't some new age concept, it's a well-established area of medical and psychological science. For centuries, healers and physicians have observed that emotional distress can manifest physically. Modern research now provides concrete evidence for these connections, showing us the pathways through which our thoughts and feelings can translate into tangible bodily changes. The core idea is that psychological factors, things like chronic stress, unresolved anxiety, deep-seated emotions, or persistent negative thought patterns, can directly contribute to the development or exacerbation of physical symptoms and illnesses. These aren't imaginary symptoms, they are real physical experiences. The distinguishing factor in psychosomatic conditions is that the primary driver or a significant contributing factor is psychological, rather than a purely organic or structural cause like an infection or injury. When we experience prolonged stress or intense emotions, our brains trigger a cascade of physiological responses. This includes the release of stress hormones like cortisol and adrenaline, changes in immune system function, alterations in our nervous system activity, and impacts on our cardiovascular and digestive systems. Over time, if these responses are constantly activated without adequate recovery, they can lead to wear and tear on the body, making us more vulnerable to a wide range of physical health problems. This is the essence of how the mind can sculpt our physical reality. In psychosomatic disorders, the physical symptoms are genuinely experienced by the individual. They are not consciously produced or feigned. The person is truly suffering, and their suffering deserves compassion and appropriate medical and psychological attention. Understanding this distinction is key to providing effective support. Addressing the psychological components is essential for managing these physical symptoms effectively. A holistic approach that considers both mind and body is usually far more successful in the long run for individuals experiencing these types of conditions. Now that we have a clearer idea of what a psychosomatic relationship is, let's delve into the why. Why do these disorders happen? The psychology behind psychosomatic disorders is complex, involving a fascinating interplay of biological, psychological, and even social factors. It's rarely a single cause, but rather a convergence of influences that tip the scales towards physical manifestation of mental distress. First, let's consider the biological factors. Our bodies are wired with systems designed to respond to threats, and a key player here is the autonomic nervous system, or ANS. The ANS controls involuntary bodily functions like heart rate, digestion, and breathing. It has two main branches: the sympathetic nervous system, our fight or flight response, and the parasympathetic nervous system, our rest and digest response. Chronic stress or unresolved emotional turmoil can lead to dysregulation of the ANS, keeping the sympathetic system in overdrive. This constant state of high alert can strain various organs and systems over time. Another crucial biological pathway is the hypothalamic pituitary adrenal (HPA) axis. This is our central stress response system. When we perceive a threat, the HPA axis is activated, leading to the release of cortisol, the primary stress hormone. While cortisol is vital for short-term stress responses, chronic activation of the HPA axis and prolonged exposure to high cortisol levels can have detrimental effects on the body. Moving on to psychological factors, these are often at the heart of psychosomatic conditions. Chronic stress is a major culprit. When we're constantly under pressure, our bodies bear the brunt. Anxiety disorders, characterized by persistent worry and fear, also keep the body in a state of heightened arousal, making it more susceptible to physical symptoms. Repressed emotions are another significant psychological factor. If we consistently suppress or avoid dealing with difficult feelings, these emotions can remain active on an unconscious level, creating internal tension that may eventually manifest physically. Negative cognitive patterns also play a crucial role. If our default way of thinking is pessimistic, catastrophic, or overly self-critical, this can perpetuate a cycle of stress and negative emotion. Then there are social and behavioral factors. Learned illness behavior is one such factor. Sometimes individuals may unconsciously learn that expressing physical symptoms garners attention, care, or allows them to avoid unpleasant responsibilities. Cultural influences also matter. Different cultures have different norms and beliefs about the expression of emotional distress and physical illness. When the mind speaks through the body, common psychosomatic disorders. Now that we've explored the why, let's look at some of the what. The common ways these mind-body interactions can manifest as specific physical conditions. It's important to remember that these are real medical conditions with genuine physical symptoms, but their onset, severity, or persistence is significantly influenced by psychological factors. First up is irritable bowel syndrome, or IBS. Many people with IBS experience symptoms like abdominal pain, bloating, diarrhea, and constipation. While the exact cause of IBS is complex and not fully understood, stress and anxiety are well-known triggers and exacerbators. The gut is often called the second brain due to its extensive network of nerves and its close connection with the central nervous system. When you're stressed or anxious, this gut-brain axis can go haywire, leading to the distressing symptoms of IBS. Next, let's talk about tension headaches and migraines. While these have different physiological mechanisms, both can be strongly linked to psychological stress, anxiety, and even depression. Many individuals report that their headaches start or worsen during periods of high emotional or mental strain. Muscle tension in the neck and scalp, often a physical byproduct of stress, can contribute to tension headaches. For migraines, stress can be a powerful trigger for these intense, often debilitating headaches. Fibromyalgia is another condition often discussed in the context of psychosomatic influences. It's characterized by widespread musculoskeletal pain, fatigue, sleep disturbances, and tender points. While the underlying mechanisms are still being researched, many individuals with fibromyalgia also experience high levels of stress, anxiety, or have a history of trauma. Psychological distress can amplify pain perception and contribute to the overall symptom burden. Skin conditions like psoriasis and eczema can also have a significant psychosomatic component. Stress is a well-known trigger for flare-ups of these inflammatory skin disorders. The immune system plays a role in both stress responses and skin health. When stress dysregulates the immune system, it can worsen inflammation in the skin. Hypertension or high blood pressure is a major risk factor for heart disease and stroke, and it too can be influenced by psychological factors. Acute stress can cause temporary spikes in blood pressure, but chronic stress, anxiety, and even suppressed anger can contribute to sustained high blood pressure over time. Then there's conversion disorder, also known as functional neurological symptom disorder. This is a fascinating and often perplexing condition where psychological stress or trauma manifests as neurological symptoms, like paralysis, blindness, seizures, or loss of sensation, without any identifiable neurological disease. The symptoms are very real and distressing, but they don't fit a known medical pattern. Managing psychosomatic disorders. Understanding psychosomatic disorders is one thing, but how do we actually manage them? The good news is that there are many effective strategies, often involving a multi-pronged approach that addresses both the mind and the body. First, psychological interventions are often central to managing psychosomatic disorders. Cognitive behavioral therapy, or CBT, is one of the most well-researched and effective approaches. CBT helps individuals identify and change unhelpful thought patterns and behaviors that contribute to stress and physical symptoms. Mindfulness-based stress reduction, or MBSR, is another powerful psychological tool. MBSR programs teach mindfulness meditation, body awareness, yoga, and mindful movement to help people become more aware of their thoughts, feelings, and bodily sensations without judgment. Psychodynamic therapy can also be beneficial, particularly when repressed emotions or unresolved past experiences are contributing to physical symptoms. Biofeedback is a fascinating technique that uses electronic sensors to provide real-time information about physiological processes like heart rate, muscle tension, or skin temperature. Alongside psychological therapies, medical and lifestyle interventions play a crucial role. Stress management techniques are paramount. This can include a wide range of practices like deep breathing exercises, progressive muscle relaxation, spending time in nature, engaging in hobbies, or ensuring adequate social support. Regular physical exercise is another cornerstone of managing these conditions. Exercise is a natural mood booster, stress reliever, and can help improve sleep and reduce pain sensitivity. A balanced diet also contributes to overall well-being and can influence psychosomatic symptoms. In some cases, medication may be part of the treatment plan prescribed by a doctor. Integrative approaches, which combine conventional medical treatments with complementary therapies, are also gaining traction. Hypnotherapy, for instance, can be effective for pain management and reducing anxiety by accessing the subconscious mind. Acupuncture, a traditional Chinese medicine technique, is used by some to alleviate pain and promote relaxation. Support groups can also be incredibly valuable, providing a space for individuals to share experiences, feel understood, and learn coping strategies from others facing similar challenges. The most effective management plan is often tailored to the individual, considering their specific symptoms, psychological profile, and personal preferences. The journey to managing psychosomatic disorders is about empowering individuals with tools and support to heal both mind and body. And ahead, prevention and long-term care for mind-body harmony. Managing psychosomatic disorders is crucial, but what about preventing them in the first place, or ensuring long-term well-being once symptoms are under control? Prevention and long-term care focus on building resilience, fostering healthy coping mechanisms, and maintaining a mindful awareness of the mind-body connection throughout life. A key aspect of prevention is the early detection and management of stress. We all experience stress, but chronic, unmanaged stress is a major risk factor for psychosomatic issues. Developing healthy emotional expression is another vital preventative measure. Many psychosomatic problems arise when emotions are suppressed or unprocessed. Encouraging open communication about feelings, whether with trusted friends, family, or a therapist, is crucial. Building strong social support networks also plays a significant role in prevention and long-term care. Feeling connected to others, having people to confide in, and receiving emotional support can buffer the impact of stress and adversity. Routine medical checkups are important, not just for general health screening, but also in the context of psychosomatic concerns. Regular visits to a primary care physician can help rule out or identify any underlying organic causes for physical symptoms. When psychological factors are suspected or identified, it's important to address them directly, even if physical symptoms are mild or intermittent. For those who have experienced psychosomatic disorders, long-term care involves maintaining the strategies that help them recover. This might mean continuing with mindfulness practices, regularly engaging in stress-reducing activities, staying active, eating well, and being vigilant about early signs of relapse. Educating oneself about the mind-body connection is also a form of long-term care. The more we understand how our thoughts, emotions, and behaviors impact our physical health, the more empowered we are to make choices that support our well-being. Furthermore, fostering a work-life balance and setting healthy boundaries are essential for preventing chronic stress overload. In today's fast-paced world, it's easy to get caught up in constant demands. Finally, cultivating a mindset of self-compassion is incredibly important. Long-term care is about nurturing a supportive internal environment as much as an external one. The journey continues, and that brings us to the end of our deep dive into the psychosomatic relationship. Thank you so much for joining us on this journey today. We've covered a lot, from understanding what psychosomatic means, to the psychology behind these conditions, common examples, and most importantly, how we can manage and even prevent them. If you found this video insightful or helpful, please give it a thumbs up, share it with anyone you think might benefit, and don't forget to subscribe for more content aimed at helping you live a healthier, more informed life. Until next time, take care of both your mind and your body.
And if you found this video interesting, don't forget to like, subscribe, and hit the notification bell for more mind-blowing psychology videos.